Welcome to the Fix Your Sciatica podcast, where we meet with experts and clients and discuss how to manage your sciatica and low back pain without the use of medications or surgery. I'm your host, Dr. Ashley Mack, and I'm a physical therapist as well as the founder of IFixYourSciatica.com, a go-to resource for pain management. A research article from 2007 stated that the lifetime incidence of sciatica is estimated to be between 13 to 40%. The link to this article is actually found in the description in today's episode. This means that approximately 13 to 40% of adults will experience some sort of sciatica pain in their life. Now, that's a lot of people. Sciatica pain is not a pleasant sensation, and I absolutely do not wish this on anyone. I started IFixYourSciatica.com and this podcast as a platform to help people living with chronic sciatica pain get back into doing the things they love, whether it be getting back into exercise, hiking, or simply playing with their kids. But there's often a lot of misinformation out there when it comes to understanding sciatica pain and how to treat it. As a result, this confusion and misinformation has resulted in improper pain management, medication abuse, depression, increased medical costs, and an increased suffering from something that can be fixed. But the key to treating this condition is addressing the pain management process one step at a time. And first things first, we need to answer the question, what is sciatica? I'm not saying that you need to have the same educational knowledge as the top doctors and physical therapists in the industry. However, I do believe that it is important for you, the listener, to have a basic understanding of what sciatica is and how to treat it, and ultimately how to live your life free from this type of pain. As a result, if you're informed, you are empowered, which is going to allow you to get to be the, as a result, if you're informed, you get to be the advocate for your care and your recovery. You'll experience greater peace of mind, control, and ultimately pain relief. So let's get down to business and talk about what is the sciatic nerve and the truth about the sciatica diagnosis. Now, the sciatic nerve actually starts at the brain, specifically at the somatosensory cortex, which processes sensation and motor in the motor cortex. Then we transition down into the thalamus and then moving farther into your brainstem. These nerves and impulses then exit your skull, forming the spinal cord, which runs from the base of your skull down through your spine. The spinal column, which is your vertebrae, serves as a protective sheath around the spinal cord, protecting it from trauma and shock absorption. And these nerves finally get to exit the openings of the spine at the levels of L4 all the way down to S3 via the foramen, which is also known as the openings. It supplies the motor and sensory signals to the back of your thigh, which includes your butt and hamstrings, but it also affects the motor and sensory function of your lower leg. The sciatic nerve pretty much extends from your brain all the way down to the tips of your toes. Now, you're probably thinking, well, what about the front of the thigh? Actually, the front of your thigh is supplied by branches of the spinal cord that forms the femoral nerve, lateral femoral cutaneous nerve, as well as the anterior femoral cutaneous nerve of the thigh. Irritation of these nerves can actually result in pain and or dysfunction on the front of your upper leg or thigh. And to be clear, this is not sciatica, but the great news is the fact that treatment of this area is actually pretty similar. But let's get back to the main reason why you hear sciatica pain. So what actually is sciatica? Here's the truth. Sciatica is a description of pain that falls in line with irritation of the sciatic nerve. Irritation of the sciatic nerve can present itself as back pain that radiates to the glutes, behind the thigh, and anywhere below the knee. It is a description of the pain location, but it says nothing about the cause or cure for this type of pain. Now, as I've just described, the sciatic nerve has a very long path from the brain down to the lower leg, and there are many structures that can cause irritation. So here are the possible causes of sciatic nerve irritation and a couple action steps for you to actually improve and feel better. Now, one of the most common causes of sciatica are herniated or bulging discs. This issue, or this tissue issue, is usually diagnosed via medical imaging like an MRI. So discs are like jelly donuts. There's a gel-like center called the nucleus pulposus that moves as the spine bends and twists. And it's surrounded by connective tissue, which is going to be like the donut portion of the jelly donut. Now, as we age, the connective tissue of the lumbar disc can get weak. And as a result, the center of that disc can push out and irritate not only the other nerves, but can irritate specifically the sciatic nerve. Usually that disc herniates backwards, which means that it moves backwards and can move out towards the side, which presses in one direction. And this can irritate a nerve root that exits the spine. And the best way to reduce a disc bulge is by moving in the direction that would actually help bring that jelly back in towards the middle. And the best thing that you can do that is move in the opposite direction, meaning that the bulge is pushing backwards. Then something as simple as leaning backwards can actually help relocate and reduce that disc bulge. If your disc bulge is pushing out towards one side, say the right, you can technically reduce that disc by leaning over to the right side because it will push everything back in towards the middle. The cool thing is that you can also combine motions, back bends and side bending, to increase the amount of force to bring the contents of the disc back into the middle. The theory is that if you can reduce the disc bulge, you will reduce sciatic nerve irritation. So how can you know that the bulge is in fact being moved in the right direction? You can tell by recognizing how your symptoms behave as a result of motions and positions. If the pain reduces in intensity, reduces in its size, or even if it moves up closer to your spine, that you're getting better. If the pain intensifies, spreads further down your leg, increases in size as in the area that it takes up, then you're probably moving in the wrong direction. You can simplify your response to a stretch or position by these three main phrases: better, worse, or the same. If you're better, continue to do that stretch or exercise more often. If you are worse, discontinue that movement or modify. And if you are the same, try the stretch again and then move on. When I'm working with patients of my own, either in person or virtually, these three phrases are going to either support my hypothesis in identifying what makes you feel better, worse, the same, or refutes it, but it's going to guide my treatment, allowing us to focus on the most effective methods to help my clients. But here's the truth about spinal discs. You might actually get significant pain relief, if not full pain relief. And more often than not, that disc is not going to change shape or position. And as a result, this then brings the question, does the disc actually have a role in sciatica pain? At this point, the scientific research has not really proven that the disc is the cause of sciatica pain, and actually hasn't really proven that it isn't the cause of sciatica pain. But what we can conclude as clinicians is that a bulging disc can alter spinal mechanics, which can in fact impact sciatica pain over a period of time. Now, the key to treating a condition like this is focusing specifically on how you, the client, the patient, the person, responds to pain and movement. And the key to successful pain management is client-centered care, meaning that the medical diagnosis via MRI, CT scans, X-rays, and others are in fact used to rule out red flags, which we will discuss later in today's episode. But the diagnosis and medical imaging should not dictate treatment. I'm going to go into a deep dive into the science of MRIs in the next episode, so stay tuned. But let's move on to the other areas that can irritate the sciatic nerve. Now, joint degeneration is another cause for sciatic nerve irritation and pain. It's synonymous with words like spondylosis, DDD, degenerative disc disease, arthritis, stenosis, and the infamous phrase, wow, your spine looks like a 9-year-old, or your spine is the worst I've ever seen. The truth is that degeneration is just a normal process of aging. Like wrinkles, degeneration is going to occur as time progresses. The degeneration of the spine won't cause sciatica itself, but the altered biomechanics, or how it moves, can affect the nerves by increasing or reducing the space of where that nerve travels. And the key to treating sciatica pain related to degenerative disc disease or arthritis is by improving flexibility of the spine and the hips. Now, pain relief will not equate to a reversal of the degeneration of the disc or of the arthritis itself, as I said before. So here's a cool fact about bones. When bone rubs on bone, it grows. It's not like you take a piece of wood and rubbing on a piece of wood and it gets whittled away. What's really cool is the fact that the more pressure and more friction that you put on bone, the more bone it grows. And arthritis of the spine is a normal part of the aging process, as I said, and it can actually accelerate based on our flexibility, behaviors, and lifestyle. And arthritis can affect our spine by changing how the body moves, aka its biomechanics. And it can also make it more challenging for our nerves to move efficiently. Now, spinal stenosis is a condition when the space where the nerve exits becomes more narrow, specifically the foramen. The smaller the space, the greater for that nerve to get irritated, which results in things such as sciatica pain because there's a lot of friction. And the key to fixing this type of problem when you're looking at a narrowing of the space is to open up the space, letting the sciatic nerve move more freely. Again, like spinal disc, even with pain relief, there's no reversal or slowing of degeneration. In fact, there are people who have a degenerated spine without any pain at all, which is why the key to pain management when it comes to arthritis and degenerative changes should be focused on relief rather than treating the diagnosis. However, conditions specifically like arthritis or even spinal stenosis would actually respond pretty well with a forward bend because you are actually opening up the space for those nerves to pass through. Now, I've worked with many clients in the past with a focus on the diagnosis of their pain, arthritis, sciatica, degenerative disc, you name it. And nothing compared to the outcomes that I've actually had for patients and clients when we focus on pain relief and how their body responded to movement. Now, keep that in mind when you're working with a physical therapist, chiropractor, or other medical professional. And in some cases, arthritic changes of the spine respond well with surgical intervention. However, the key to a successful surgical procedure for your pain is that you have to exhaust all conservative measures first, because most of the time, this condition, sciatica, can be treated without getting under the knife for surgery. And another cause of sciatica is hyperactivity or weakness at the piriformis muscle. This piriformis muscle is part of the deep hip musculature, and it originates at your sacrum, the base of your spine, and it attaches to the greater trochanter of your hip, which is a bony part of your thigh at the highest point. Now, depending on your anatomy, the sciatic nerve passes right underneath or pierces right through this muscle, and a tight or weakened piriformis can irritate the sciatic nerve, resulting in sciatica. More often than not, this piriformis muscle is tight as a result of core instability and weakness. And the best way to treat sciatica pain related to piriformis dysfunction is through stretching the muscle to calm it down and then adding core strengthening to prevent future flare-ups. You could do something like a simple pigeon stretch. You can massage it with a lacrosse ball as well. But one overlooked way to reduce the dysfunction of this muscle is getting a better understanding of your standing position. You look at yourself in the mirror, is your hip pushed out to one side? What if you move your pelvis underneath your shoulders? Does that have any impact on your pain? The key, again, is finding the position or positions that provide the greatest amount of relief for you. The sciatic nerve can also be irritated at the level of the hamstrings. If they are significantly weak or tight, the best way you can relieve hamstring tension is through hamstring stretching, massage, and strengthening of these muscles. You can also improve hamstring function by repositioning your pelvis into the neutral position. You can do this by simply arching and rounding your spine while standing, and then finding the midpoint between these two extreme positions. Now, the sciatic nerve does split once it crosses the knee joint and forms a series of nerves. They run under and between your calf muscles, and as a result, tight and weakened calf musculature can also result in sciatic nerve irritation. And you can address calf and lower leg tightness by massaging this area using a foam roller, lacrosse ball, or anything else. I also like to use my hands to massage my own calves. But again, the key is to finding the positions, stretches, and exercises that provide the most amount of relief for you. Now, I've just discussed many of the causes of sciatica pain that can be affected by movement and conservative measures, aka no medications, no surgeries. They would do best with an approach that is focused on finding the best stretches, exercises, and positions that bring you, the listener, the most relief. You can save yourself a lot of pain and suffering by listening to your body and implementing the strategies that provide you with the best pain relief. However, there are instances where sciatica pain is a result of something that requires more of a medical surgical follow-up. It can be due to physiological changes in your internal organs or due to actual trauma of your spine or any other region of your body. You can determine whether or not your pain needs to be assessed by another medical professional, such as a physician, orthopedist, or surgeon, by ruling out medical red flags. So what's a medical red flag? These are signs and symptoms that indicate that you would not benefit from a mechanical-based treatment program. Red flag questions are usually the questions that you see in a medical history where it says, if you answer yes to any of these questions, please explain in further detail. Usually the time domain for these medical red flags is at since the start of your pain. So here are some examples. Since the onset of your symptoms, have you experienced nausea, vomiting, or diarrhea, bowel and or bladder changes, dysfunction, saddle anesthesia? For if you don't know what saddle anesthesia is, that is going to be numbness in the area of your pelvic floor, complete loss of function and sensation in any of your limbs, unrelenting pain, pain that wakes you up in the middle of the night, night sweats, and any sort of unexplained weight loss or gain. If you're answering yes to any one of these questions, you should be seeking out a medical professional. However, if you answer no, and your pain is in fact influenced by movement and position, the good news is that there is hope for you. Whether pain has been around for an hour or years, if your pain is influenced by movement, there's something that can help you. The key to your success in treatment is finding out what makes you feel the best. Do more of the things that make you feel great, and reduce, eliminate, or modify the activities that make your pain worse. So I'm going to challenge you today. Grab a sheet of paper and make 2 columns. The column on the left are the positions, stretches, and exercises and activities that make you feel the best. Try to incorporate more of those into your day. The column on the right are going to be positions, stretches, exercises, and activities that make you feel worse. Try to minimize, eliminate, or modify these activities so that you can heal and recover. The great news is that you are not alone on this journey. Talk to a friend about your challenges, or better yet, reach out to us. You don't have to go through this pain alone, and you don't deserve to live in pain. And it's time for you to take action in your recovery. Thank you for listening.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.